Hi, my name is Jasmine Pope, and I'm going to explain how to wash a patient's face for Professor Gano's Fundamentals of Nursing Week 5 videos. So first things first, knock on the door, go in, introduce myself, explain to the patient what I'm here to do. And upon entering the room, I have my supplies, which include 2 water basins and 3 washcloths, one for rinsing, one for washing, and one for drying. After that, I'm just going to explain what I'm going to do, have the patient state their name and date of birth so I can make sure that it is the correct patient. Anytime you're performing like a full bed bath, you want to make sure to move down from the head to the toes, but we're just going to focus solely on the face in this video. So I would first start with, after I've washed my hands and performed hand hygiene, I have my gloves on, I would go over to the patient and I would let them know that I'm going to place a towel under their head, just because, some water droplets may or may not get on their pillow. So first things first, I would start with the eyes and I would not use soap. I would make a mitt. I do have gloves on. I would make a mitt like that, making sure it's tucked with my hand, and basically I would have 2 wash basins filled with warm water. One rag is for rinsing, one rag is for washing, and I have my dry towel on the side. I would start with the eyes, making sure that I do not cross-contaminate using different washcloths. I would start with the left eye, and I would start in the corner, so wiping and just kind of going out and downward. So you're taking the most dirty part and you're moving away. You're not taking the dirty and going towards the eye. You're taking it away from the eye. From there, after I move out and downwards, I would then change sides of the washcloth, rinse, and then I would then clean the right eye, making sure that I'm again moving out and downward, coming away from the dirty part. I would make sure to pat dry each eyes with the towel, the dry towel. And then from there, I would get the washcloth, and I would start in circular motions, probably at the forehead area, moving downward to the cheeks and chin area, and then lastly the ears. Basically, you want to make sure that you're going from the cleanest to the dirtiest part of the face, so you don't take certain bacteria from one part and put it towards another. You want to just make sure that you're gentle, you're using circular motions once you are on the actual face and not the eyes. You want to make sure you're talking to the patient during the time, making sure the water is warm enough that they're comfortable and things like that. And that's how you would wash a patient's face.